Okay, so sticking with that same shoulder, let's look at some other motions that I don't do very well. If you just stick with one, you're going to miss out a lot of other stuff that you could be looking at. And I just thought of one. Sorry, all that noise is probably my dogs or something. This and this, there's a big difference. Wait, I can get up to there. What other ones are a big difference? So, this is one thing that I noticed. I want to show you something. When I'm normal, in what, quote, looks like anatomical normal, I go to lift this. Doesn't. Offer a little flexion into here, and I can lift it. Go back into the neutral position or even slight extension, nothing. More extension, even less. But I want to compare that to this. In my anatomical looking position, not a problem over here. Go into the flexion or slouching in my chest, not a problem. Go into more overextension, gets harder, but I still can do it. So a good size difference there. All right, now, which way should I treat it if I did choose to treat up in the upper body? Do I flex this way and do this one? Do I come over here? So I can't go into extension here, so do I do it or anatomical neutral with lifting? Or do I just go over here and do anatomical neutral and lift? Or do I go here and lift? Or, which you're not going to see a lot, now watch this. Isn't this the good? So here's good. What I've got to determine is this smoother than this side? No, it's still easier over here. Alright, so I'd probably stay over here and see what the result is. Before I do, again, I want to move elsewhere in the body and see what happens, okay? Just see what I find. Now, one of the motions that I like to do, I call it the sumo wrestler, and then I get way down like this, and what I do is I get way down on my slouch and I pick a leg up. So you notice that does it. Now I'm going to come over here, do the same thing. Ow! Now, if you could reverse yourself and make this be your shoulder joints, because see, the shoulders move like this, the hips kind of move like that. If my head were here, okay, and flip me back up, there's my legs, there's my head, there's my pelvis, which is now my shoulders, and everything else. So we're identical. We have several areas of similarities or duplications. Actually, there's they come in triplets, probably come even more than that. If you know that, and you can find areas that are restricted with similar motions. So for example, I hurt myself doing a push-up, okay? Well, doesn't this kind of look like a push-up? Alright? I'm not sure if that's hard to understand what I'm saying on that part, but that resembles something. You can see how much more difficult it is over on that side, okay? I can just barely pick it up and pop it. All right, now a couple other ones that I want to try that I'll show you. Well, what else is going on? Let's see about this one. See? I just don't want to do any of that. So there's some stuff. I'm going to move the camera for a second and show you some other things going on. I'm going to test my shoulders in weight bearing. So I'm going to be on my knees on this one. Oftentimes I don't have to. Today I need to. So this one, not a problem. I can even pick up off my knees. But this one, I don't even want to be there. All right? That was me trying to come off my knees. Okay, ow. So, the question becomes, where do you start? Now guys, I'm showing this interesting stuff to get people to pull away from their mind of, I need to treat the area of pain. Alright? So no, I'm not following the Fab Five. Should I? Yes, I should, because it gives me a system to go. Now, as somebody gets more advanced and they want to start fiddling with their body and seeing what correlates and what patterns there are, I mean, that correlation of that sumo wrestler with the point of injury could be perfect. It could be the one that helps everything out. And so what I'm going to do is I'm going to start with a sumo wrestler. I'm going to treat myself out a couple. We'll go back and see what our shoulder raise looks like. See if it's better. All right, fair? Okay. Now, how many do I do? I don't know. I don't know how long I can stay up, but 1, 2, 3, 4, 5. I sink down a little more. 1, 2, 3, 4, 5. 1, 2, 3. 1, 2, 3. Feels pretty good. I'm gonna go a couple more. 1, 2, 3, 4, 5, 6, 7, 8, 9. So I'm just trying to stay there. I know I'm leaning more, other stuff, but there is no form. It's just picking that other leg up and seeing whether you can keep it there. 1, 2, 3. 1, 2, 3, 4, 5. Okay. So I'm going to retest my sumo on the other side. And then I'm going to retest the weights lifting. It doesn't hurt. Like, I feel like with a lean, I can do it at least. Let's see what this does. In anatomical. Guys, I never know what this is going to do. Don't ever know if it's going to work or not work. It's all about the result, and that's a huge result. Huge. It feels awesome. It feels absolutely awesome. It's actually, some of the times when I'm teaching this stuff, whether it's on video or in front of a group, I learn things right away. That thing about the sumo wrestler being very similar to a push-up, a vertical push-up like I was doing, that got me hurt, that's cool. So I'm going to do a couple more sumos. Now, after I do a couple more sumos, I'll retest that, and I'll go back and retest my weight bearing on those arms too. Is that fair? Test the sumo. Oh, feels so much better on that side. Oh, feels a lot better. Just want to connect it one more time over here. I don't like to leave it on the testing the bad side. I like to leave on the good. All right, let's see what my anatomical looks like now. Look at the speed of it. That is so cool. Gonna even extend some of that. Feels like the other side. A little bit up there. Let's check this out. So I just changed up the camera a little bit so you can see me a little better. And so, watch this now. This one now, still weaker than this. But I'd say at least 50-60% better. So, I could clean up with that. Maybe I'll find another one that works better, more out of balance. I could go to my sit to stand that I did from the chair to see what it does. So, I hope I'm intriguing you enough to go, wow, maybe this is one of the reasons that I'm not getting certain people back. Fair? I hope it'll spur you on to move away from the point of injury. It really, really makes a huge and astounding difference, especially if you think about it. These muscles are tiny. These are huge. If they're in reflexive spasm, or there's a normal spasm somehow, or out of balance, or the bones are shifted, or anything like that, that's going to have a bigger effect on the body. Because not only is it lower in the body, what I mean by that is down here, physics-wise explains it, is that if this were contorted, pulling tight, this has a huge lever arm. So now we have a big force, huge lever arm going to the shoulder. And because of that huge lever arm and the strongest muscles, it's putting a huge, tremendous effect on the shoulder. Fair? Where if I just have this tightening down, it's not going to have it just can't produce as much power as this and that huge lever arm. And that's some physics kind of stuff.